Hi, everybody. This is Dr. Kaboni Mwapindi. I'm coming to you today to thank you for the survey that you completed. And I'm going to review some results with you. We are very grateful for your participation, and you provided so much information that our organization will be able to learn and grow and improve. So thank you very much for your time. Dr. Kaboni QHSC decided to do this survey so we can learn from our 6 COVID conferences. We want to make sure we're giving you content that is applicable for your clinical practice, and we can learn from it and improve our delivery mode, and then we can provide you with evidence-based in clinical practice, things that we can take from our conferences and go and apply on a clinical practice. I want to thank all the panelists who have attended and came and contribute to the expertise for those 6 conferences. So I am going to review these results for the conferences, and also I'm going to send you the attachment. So if you want to read it for your own record, that's great. So we created the survey on July 4th, and we send it to all the emails for the people who came to our conferences. And then also we send it to the WhatsApp groups. So we can try to see whoever attended or have viewed our videos, they'll be able to come and give us the feedback so we can improve. So we can always improve, so we can give you something you use it every day. So as I said, the survey was sent on the 4th. And then so the first time we send, we get 45 responses. And then when you get the reminder 5 days later on the 9th, there was 34 responses. And then when you send the second reminder on July 15th, we got also 19 responses. We were planning to do this survey for only 2 weeks so we can get information and work on it and improve. And so the next time when we start doing more conferences, we want to make sure we include your feedback and we take it very seriously. So, and again, I thank you for taking the time to respond to these questions. And when we're doing this, we're planning for this survey, we're only thinking of only 20%. Those are usually statistical responses. But we were lucky enough, we got 27 return. So that was great. So what did we learn from this survey? So there was a lot of things we learned, and I said there was 95% people who responded, and again I appreciate that. So majority of the time from all those responses, they were the first 8 questions which we really needed to know how we're doing and what things we can do better. And then question number 9 and 10, those were just, we were asking people who wants to get more involved with the organization and also be more participant on the content delivery, and so we can give you things that will benefit you in clinical practice. So question number 1. So the question number 1, we wanted to know for those people who are registering to attend to the end of the conferences, how many conferences did you attend? So for that question, there was 72 people responded and said they attended at least once of the conference. And then there was like 8.4%, which was like 8 people were registered, but they did not attend. And then 4.2, they were registered, but they had technical difficulties to, during the day of the conference was offered. 7.35 they were unable to attend due to either they had prior arrangements or appointments. And so some people added some free text on that question. They said some of them could not attend because of the financial reasons. Either they didn't have the service, provider services were not available at that time, and they could not attend to the meeting. So we take those suggestions and we try to work on it, try and improve the service. So for number 2, the organization wanted to know if for any of the content that you receive, was it pertinent for what you do every day? So 88 responded, and then 7 people skipped that question. Well, in those 88, so they gave us some feedback. There was a lot of information. As I said, I appreciate for people who responded. But we summarize and just say majority of the people are saying they find those conferences are valuable. They gain a deeper understanding and the importance of evidence-based, and then also they learn new concepts, so which makes us very, very happy. And then they appreciate conferences were presented from the global perspective, and then so they can learn from multiple disciplines provided there, and the attendees were happy, and they incorporated those lessons to their clinical practice. So those I appreciate for other people who have used this lesson and all things that you learn from the conference, so we can highlight and showcase what you have done to know that if we can help further for what you're doing to help your clinical care, and we would be happy to do that. So for number 3, the organization wanted to know your opinion for those who attended, and if there's anything that we can improve our delivery mode. So 85 responded, and then 10 skipped this question. So those who responded, they said they would like to see if we can limit the time of conferences. So I know some of the conferences went for 3 hours, so they wanted us to manage that time and see for if we can have less panelists so they can share maybe one topic, and then we can discuss in details. So we take that into consideration, and we will address for the next conferences. So the question number 4, the organization wanted to know from the attendees your perception of the conferences organization. So, and those are just the table depict what the responses were. So majority of them saying the conferences was organized, and then so followed by it was extremely organized, and then somewhat organized. So we appreciate all the feedback. As I said, we try to make sure we include all your feedback to what we do next. So for number 5, we wanted to know what the attendees find helpful or interesting from any of the conferences. So this one was a lot of responses, and we appreciated that. And a lot of people were commenting for more than one, which is great, and we appreciate that. And I'm glad that it was helpful for a lot of people, because you provided a lot of details. So for the summary of just the highlights of majority of the people, what they say, and things that we can learn from. For the first conference, which was the Global Experiential Nursing Practice. So this was mentioned 18 times. And then so the people enjoyed and learning that from different areas of the globe, people share the same concern and clinical practice. So that was, it was nice to see other evidence-based that is practiced in different parts of the world. And then the second one was the Global Experiential Purpose Management for COVID. So this was mentioned 20 times by the participants. And then the majority of the people were talking about, they learn about the drugs and how the drugs works, how it affects and the side effects. And also they learn how to take care of the patients who are on those protocols. So that was helpful. Number 3, there was the third conference, was staying safe, what to do, infectious disease, and that's the same week it was Mrs. Week. So the conference was mentioned 30 times, and the majority of the participants said they were enjoyed to learn how the COVID ability to infect or spread, and then they enjoy learning about being safe, especially in the clinical setting, and preventing themselves, their family, and their patients from the COVID, and also learning how to clean up the equipment. And there was a presentation about meals, so people enjoy learning about the scoring meal, which will help with the clinical assessment. And then, of course, majority of the people was talking about the demonstration about the PPE, how to put it on, and donning and doffing. So that was helpful from that conference. So the conference number 4, it was the crisis interventions. This conference was mentioned 30 times, and majority of the people said they acknowledge the benefits of this conference, and that the expertise were there to provide the guidance or education and management of the stressful environment for nurses and healthcare workers in general, and then the impact on mental health awareness, And then that majority of you also mentioned that this conference was very emotional because a lot of people have under the assumption that healthcare workers believe to be strong human beings. So seeing that people are being vulnerable and sharing their experience, it was a very insightful conference for majority of you. So we appreciate that. Number 5, this is conference of safety and with the patient benefit. So this conference was mentioned 9 times, and majority of you guys were enjoying to learn about the professionalism, communication, teamwork, accountability, and competence. And also others learn about the challenges that the nurses in Tanzania were facing and how to address those concerns. And then the importance of protecting patients' confidentiality, and you learn about the advantage of working in the teams. And the feedback from the conference number 6, a career in healthcare in light of COVID. So this conference was mentioned 11 times by the attendees, and then the feedback was provided for understanding the students share their fears and concerns about the global, around the global, and then also others enjoyed to learn about that even other students are facing the same challenges of the COVID and how the disease is affecting their schoolwork or the way that the schools are learning. Okay, so for number 6, the organization also wanted to know what did you find helpful? Could it be helpful if you knew something before the conference, or just registration and then show up at the conference was enough? So there was 82% responded to this question, but 13 people skipped this question. Of those, 61 of them said no, there was no need for other information. They were happy just to show up during the conference. And then 21 of you said, yes, you wanted to probably, if we included the handout before the conference, so that we could have helped with reviewing before the conference so you can participate. We understand that sometimes it might be difficult to get those content before the conference, but if we do, we might be able to do that. We can address that for future conferences. And then people wanted to know the duration of the conference. So we will include that on our planning from now on to inform you how long the conference is going to be. So number 7 also, we wanted to know, okay, so what are the things that you think is the adequate time for conference? So we put different times there, but you can see majority of the people thinking 2 hours is adequate. And then close less than 2 hours or just 2 hours and a half. So you can see majority of the people thinking it was that. So we're thinking of around 2 hours or a little bit less. That could be appropriate. So we will include that in our next planning phase. For number 8, we wanted to know the demographics. So we wanted to know who is responding to these questions so we can tailor our response in future planning. So this question, we want to know if you're healthcare or non-healthcare workers or if you're students. So you can see there was 76 of you who responded, you're healthcare workers. So thank you for doing that. And then 8 of you, those non-healthcare workers, which we welcome everybody who can come and work with us. And then 6, they were students. So we appreciate that. And as I said, those are the things that will help us to plan for the next, for future conferences. So number 9 and number 10, as I said before, these are the questions that we were just asking people who are willing to provide their emails so we can contact them or include them in the future discussion if we need to get information about a specific topic or if we can collaborate in certain things. So those are the 2 questions that we're asking. Those who volunteer their emails, then we're going to start communicating with you individually or as a group to make sure we include you for the future plans for any project or activity that is planned by the QHSC. So with that, I'm going to say again, thank you very much for all your time for answering these questions and for providing us with the suggestion, feedback, and all the ideas so we can improve our delivery mode for our conferences and improve our organization and improve the way we offer these conferences to make sure you are gaining the most out of it. And we appreciate your support, and we encourage you to come and visit our website and see what we do And if you can contribute or participate, please don't hesitate to contact us at drgaboni@QHSC@gmail.com. Again, thank you very much and have a great evening. Bye.